6. Warning signs an elderly person may be in their final year. What you need to know. Aging is a journey, one that many of us will eventually face with our loved ones, and it's often filled with moments of joy, wisdom, and reflection. However, it's also a process that comes with its own set of challenges and realities, particularly when we reach the later stages of life. It's easy to push the topic of aging aside, especially when it involves acknowledging that an elderly person may be nearing the end of their time with us. But facing these truths head-on can make a world of difference in how we care for our aging loved ones, ensuring they feel understood, supported, and respected during their final years. For many families, recognizing the signs that an elderly person may be in their final year is not about predicting death. It's about being present, providing the right care, and cherishing the moments left. In a way, it's a privilege to be able to offer comfort and understanding when a loved one can no longer express their needs in the way they once could. The signs are subtle at first: small changes in behavior, a little more fatigue, perhaps a shift in how they interact with the world. But these changes, while difficult to face, can help us understand their needs on a deeper level and ensure that they are met with dignity, love, and peace. It's not always easy to navigate this path. As people age, their bodies and minds go through changes that can be hard to keep up with, and these signs can sometimes catch us off guard. Physical decline, cognitive changes, and emotional shifts are all natural parts of aging. But when they begin to signal that the end of life might be near, it's essential to understand what's happening. Recognizing these signs early on gives us the chance to adjust our approach, whether it's making their environment safer, seeking out professional care, or simply spending more quality time together. Throughout this video, we'll explore 6 of the most common signs that an elderly person may be entering their final year. This isn't about predicting or fearing the inevitable, but about offering compassionate support during a time that can feel uncertain for everyone involved. It's about giving both them and us the chance to process, reflect, and prepare, not just for the physical challenges, but for the emotional journey that comes with the realization that the end is near. Understanding these signs can be a powerful tool. They help us make better decisions, offer the right kind of help, and most importantly, show our loved ones that we see them, we hear them, and we are with them through every step of this journey. As you go through this with us, remember that each person is unique, and while these signs are common, they might manifest differently in each individual. What matters most is that we meet them where they are, with love, patience, and understanding. Sign 1. Physical decline and frailty. As our loved ones age, one of the first noticeable changes is often their physical decline. It's not always dramatic at first. It might start with small signs like difficulty getting up from a chair, a slower pace when walking, or a little more fatigue after doing something they once found easy. However, over time, these physical changes can become more pronounced and may serve as an indicator that the body is preparing for its final stage. One of the clearest signs of this decline is the loss of muscle mass and strength. As people get older, their bodies naturally lose muscle tissue, a condition known as sarcopenia. This process is often gradual, but it can make a significant difference in how a person feels and moves. Tasks that were once easy, like carrying groceries, climbing stairs, or even holding a cup, can become increasingly difficult. For some elderly individuals, a sudden or noticeable weight loss could also indicate that their body is no longer able to maintain the strength it once had. This physical frailty often manifests as decreased mobility. You may notice that your loved one is no longer as steady on their feet as they once were. They may start to shuffle when they walk, or have difficulty getting up from sitting. A simple trip to the store may now require assistance, and getting in and out of a car could become a struggle. While these changes might seem like a natural part of aging, they can also point to something more serious: physical decline that signals the body is gradually shutting down. The increased risk of falls and injuries becomes a major concern as mobility decreases, and even simple everyday activities that once seemed effortless can become exhausting. It's also important to keep in mind that physical decline doesn't just affect the muscles or bones. It also affects the organs. The heart, lungs, kidneys, and other vital organs can start to lose their efficiency. The elderly body becomes less resilient, and it becomes harder to bounce back from illnesses or injuries. For instance, a cold or the flu may linger longer than it did when they were younger, and it may lead to further complications. So, how can we help? The key is to ensure that their living environment is adapted to their new needs. If they're having trouble walking, perhaps it's time to invest in a walker or cane. For those with significant mobility issues, wheelchair access might be necessary. Additionally, home modifications like grab bars in the bathroom, ramps instead of stairs, and clearer pathways can make a huge difference in ensuring their safety. The emotional toll on your loved one as they experience these changes can also be significant. It's normal to feel a sense of loss or frustration when the body no longer does what it once could. Compassionate caregiving is essential. Understanding their struggle and offering your support can make them feel seen and valued. Even though their body may be slowing down, their need for love, respect, and dignity remains constant. Sign 2: cognitive changes and memory issues. As physical decline begins, cognitive changes often follow suit. Memory lapses are among the most noticeable early signs that an elderly person might be entering the final stages of life. While it's normal for all of us to occasionally forget a name or misplace our keys, when these lapses become frequent or more severe, it's time to pay closer attention. Forgetfulness can start with simple things, like not remembering where they left something or forgetting the day of the week. Over time, this can progress into more significant memory issues, such as not recognizing familiar people, forgetting names of close family members, or having trouble recalling recent events. The confusion can become disorienting, leading to frustration, sadness, and even anxiety. Sometimes individuals may not even be aware of their memory loss, which can make it especially challenging for caregivers and loved ones. One of the most common cognitive issues that arise in the elderly is dementia, which includes a wide range of cognitive impairments. Alzheimer's disease, the most well-known form of dementia, affects memory, thinking, and behavior. The progression of this disease can vary, but the impact is always profound. Over time, someone with dementia may have trouble performing basic tasks that they once did with ease, such as cooking a meal, managing finances, or taking care of personal hygiene. While memory issues are often associated with dementia, cognitive changes can also be a result of other conditions, such as Parkinson's disease, strokes, or even medication side effects. Regardless of the cause, when cognitive decline reaches a certain level, it can signal that the individual is entering a more vulnerable stage of life. Their ability to communicate, understand, and make decisions becomes compromised, which in turn increases their reliance on others. For families and caregivers, witnessing the cognitive decline of a loved one can be incredibly difficult. The person they once knew may start to fade into someone unfamiliar, and this loss can be heartbreaking. What's even more challenging is that the emotional and psychological toll of memory loss can be just as profound as the physical effects. Many elderly individuals with memory issues may feel confused, scared, or even ashamed of their cognitive decline. As caregivers, it's important to approach them with patience, empathy, and understanding, always providing reassurance and creating a calm, supportive environment. What can we do to help? It's important to provide memory aids and create routines that help minimize confusion. For example, using calendars, reminder notes, and medication charts can keep them oriented to the day and help them stay on track with important tasks. Simplifying daily routines and reducing unnecessary stress can also make a significant difference. The use of memory aids should be coupled with emotional support, allowing them to express their feelings without judgment, offering reassurance, maintaining a familiar environment, and finding gentle ways to stay connected can go a long way in easing the emotional burden of cognitive decline. As difficult as it may be to watch someone's memory fade, the most important thing you can offer is your presence. Even when they no longer recognize you or remember past conversations, your love and care can provide them with a sense of comfort and peace in their final years. Sign 3. Loss of interest in socializing and hobbies. When someone we love begins to withdraw from social activities and the hobbies they once enjoyed, it can be one of the hardest signs to recognize. For many elderly individuals, their social life and hobbies were a huge part of their identity. Whether it was spending time with family, meeting friends for coffee, participating in community events, or enjoying pastimes like gardening, reading, or knitting, these activities provided not just joy, but a sense of purpose and engagement in the world around them. So when they start to lose interest in these things, it can feel like something fundamental has shifted. The loss of interest in socializing is one of the clearest signs that an elderly person may be nearing the end of their life. While there could be many reasons for a person to withdraw, health problems, feelings of depression, or even the natural slowing down of energy levels, it's important to take note of these changes. This withdrawal from social interaction may not always be accompanied by a direct complaint of not wanting to engage. Instead, it can manifest as a subtle disinterest or indifference toward once cherished activities. Perhaps they no longer make plans to see family or friends, or they lose interest in hobbies like watching their favorite TV shows, going for walks, or reading books they once loved. Conversations that once brought them joy may now feel burdensome or unnecessary. Part of this may be due to a lack of energy or the gradual physical decline that makes socializing more difficult. Social interactions often require effort, physically, emotionally, and mentally, and as the body tires and health issues increase, engaging in social activities can become overwhelming. There's also the emotional side to consider. Some elderly individuals may begin to feel disconnected from others, especially if they experience memory loss or cognitive decline, which can make interactions feel confusing or exhausting. The fear of burdening others or not being able to keep up with conversations can lead them to retreat further into solitude. Another factor in this social withdrawal is the shift in how an elderly person views their own place in the world. Aging often brings with it a sense of nostalgia or an awareness that time is running out. And this realization can create a desire to retreat from external distractions and focus on personal reflection or even acceptance of the inevitable. They may begin to feel less connected to the outside world, especially if they experience physical limitations that prevent them from engaging in activities they once enjoyed. As difficult as it is, It's important to approach this sign with sensitivity. Social isolation can lead to depression, which can make an already challenging situation even more complicated. Offering gentle encouragement to participate in social gatherings while respecting their pace and comfort level is key. It's not about forcing interaction, but about creating opportunities for connection. Whether it's a quiet walk, a phone call with a friend, or a visit from a loved one, showing that you care and that their presence matters can make all the difference. Sometimes, even just being there, sitting together in silence, can provide a sense of companionship that transcends the need for words. Sign 4. Increased sleep and fatigue. It's natural for people to slow down as they age, but when an elderly person starts to sleep more than usual or exhibits noticeable fatigue, it can be a sign that their body is preparing for its final stages. We all experience moments of tiredness or need for rest. But when the need for sleep becomes excessive and the energy to do even basic activities wanes significantly, it's worth paying attention to. This sign can often be subtle at first. An afternoon nap that stretches into a few hours, or an early bedtime that seems to become the norm. Over time, however, the sleepiness can become all-encompassing, and their energy levels may feel almost depleted. Increased sleep and fatigue are often linked to the body's natural aging process. As we get older, our bodies no longer produce the same amount of energy they did when we were younger. Muscle mass decreases, bones become weaker, and the organs slowly lose their efficiency. It becomes harder to fight off infections, and recovery from illness or exertion takes longer. These factors can lead to a heightened need for rest. While some elderly people might sleep a little more due to these physical changes, others might find themselves constantly exhausted despite long periods of sleep. When a person is nearing the end of their life, their body's systems begin to slow down in preparation for the final stages. The need for rest intensifies as the body conserves energy for its most essential functions. Many individuals will experience a significant increase in sleep as the body naturally shuts down. Some elderly individuals may sleep for most of the day, waking up only for meals or to use the bathroom, and often they are unable to stay awake for prolonged periods. This change can be alarming, especially if it seems to happen suddenly or without an obvious explanation. It's also important to consider the emotional aspect of increased fatigue. When an elderly person is constantly tired, they may feel frustrated by their inability to engage in activities they once enjoyed. They may express feelings of guilt or sadness about not being able to keep up with loved ones. Or they might withdraw even more into themselves as they struggle with their declining physical and mental abilities. As their fatigue deepens, they may also become less communicative, which can make it harder for family members to gauge their emotional state or understand their needs. So, how can we support them during this time? First and foremost, it's essential to ensure that their physical comfort is being addressed. Make sure their environment is conducive to rest, whether that means adjusting their sleeping arrangements or providing softer bedding. While it's important to allow for plenty of sleep, it's also crucial to monitor their health for any signs of complications, such as dehydration or malnutrition, which can exacerbate fatigue. Encourage them to eat, stay hydrated, and participate in light activities if they are able. But respect their need for rest and avoid pushing them too hard. When excessive sleep and fatigue are coupled with other signs of decline, they can point to a deeper process of the body winding down. Instead of focusing on the frustration that might come with watching someone sleep more or appear less energetic, offer comfort and reassurance. Provide a calm, quiet space where they feel safe and loved, allowing them to rest as their body needs, while ensuring that they are being cared for physically and emotionally. This is a time for gentle support, patience, and understanding. Sign 5. Sudden changes in behavior and mood. As our loved ones age, it's common for their behavior and mood to shift over time. But when these changes happen suddenly or drastically, it may signal that something deeper is occurring, something that might indicate they are nearing the end of their life. These mood swings or behavioral changes are often linked to both physical and emotional shifts that are hard to navigate, both for the individual experiencing them and for those caring for them. It's important to understand that these changes aren't always a result of psychological issues or cognitive decline alone. The elderly may be experiencing physical discomfort or pain that they can't easily articulate, and this discomfort can manifest in mood changes. For example, they may become more irritable or anxious without an obvious reason. The frustration of dealing with chronic health problems, the fear of losing independence, or the sadness of confronting their mortality can all lead to shifts in mood. The emotional toll that comes with the awareness that their body is failing or that life is nearing its end can cause a person to react in ways that might seem out of character. Sometimes, elderly individuals experience an increase in confusion, which can lead to mood swings. This might be a result of cognitive decline, medications, or even a simple infection that disrupts their mental clarity. When they forget things or can't find the words they need to express themselves, it can cause frustration that leads to outbursts, anger, or even sadness. At other times, feelings of sadness or anxiety may appear more often, with the individual becoming withdrawn or tearful, without any clear trigger. Another significant factor is the internalization of feelings about aging and death. As an elderly person gets closer to the end of life, they may begin to feel a sense of loss, not just of their physical capabilities, but also of their place in the world. They might reflect on their past achievements or, conversely, on what they feel they have left undone. These thoughts can trigger deep emotional responses that manifest as mood swings, irritability, or periods of calm, followed by sudden outbursts. As a caregiver, these behavioral changes can be difficult to witness, but it's important to respond with understanding and compassion. If they become irritable or withdrawn, it's essential to remind them they are not a burden, and that you're there to support them no matter what. Patience is key. If they seem upset or agitated, try to de-escalate the situation with gentle words or a calm presence. Sometimes, offering a change of scenery, a comforting touch, or a distraction can help soothe their mood. Professionals such as doctors or therapists can be invaluable in helping navigate these emotional changes. If the behavior changes are tied to pain, depression, or confusion, addressing the underlying cause through appropriate medical care is crucial. Offering reassurance and maintaining a sense of stability in their routine will provide comfort and support during these emotional fluctuations. Sign 6. Decreased ability to engage in self-care. One of the most telling signs that an elderly person may be nearing their final year is a noticeable decline in their ability to engage in self-care. These are the everyday tasks that many of us take for granted: bathing, dressing, eating, grooming, and managing medications. When these tasks become increasingly difficult or even impossible for an elderly person to complete on their own, it may indicate that their physical and cognitive decline has reached a stage where their body is no longer able to function as it once did. The first signs of this decline might be subtle. Perhaps they start needing help getting dressed or taking longer to bathe. You might notice them skipping meals or forgetting to take their medication, even if they were once meticulous about their self-care routine. As this progresses, they may become unable to perform even basic tasks like brushing their teeth, combing their hair, or changing clothes. Simple activities that once felt automatic may require significant effort or assistance, and that loss of independence can be incredibly difficult for the elderly to accept. This decline in self-care often stems from a combination of physical and cognitive challenges. Physically, they may lack the strength or stamina to complete these tasks. They might feel pain or discomfort that makes bending, reaching, or standing difficult. Cognitive decline, on the other hand, can lead to forgetfulness, confusion, and difficulty recognizing the importance of self-care. For example, they may forget to change into clean clothes or neglect to bathe because they simply don't remember the need or can't grasp the idea of self-maintenance. This sign can be particularly difficult for family members to witness. Self-care is often tied to a person's sense of dignity and independence. As they lose the ability to take care of themselves, they may feel embarrassed, ashamed, or frustrated. This can lead to increased dependence on others for even the most private personal care. It's important to remember that while the elderly person may be struggling with their independence, they still need to feel valued and respected. Their sense of self-worth is still intact, and it's crucial to maintain their dignity during this time. As a caregiver, it's essential to approach self-care support with sensitivity. While it may be necessary to assist them with tasks like dressing or bathing, it's vital to do so in a way that preserves their autonomy and comfort. Ensure that they feel safe and comfortable when receiving assistance, and try to provide privacy whenever possible. For example, while helping them get dressed, offer as much independence as possible, letting them choose their clothes, and making sure they're as involved in the process as they can be. Similarly, if they need help with hygiene, try to make the experience as respectful and dignified as possible. This stage may also call for adjustments to the home environment to ensure safety and ease of movement. Installing grab bars in the bathroom, using shower chairs, or providing adaptive clothing can make a big difference in promoting both comfort and independence. Additionally, providing emotional support during this time is just as important as assisting with physical tasks. Acknowledge their frustration, offer praise when they accomplish something, and remind them that it's okay to need help. The goal is to create a compassionate and supportive environment that respects their dignity while providing the care they need. This stage of life can be filled with vulnerability, but it also presents an opportunity to show your loved one that they are still seen and valued. Even though their body may be failing them, their spirit and the love they've shared with you throughout their life remain as important as ever. Conclusion: embracing the journey with compassion and care. As we reflect on the 6 signs that an elderly person may be nearing their final year, it's crucial to remember that aging is a deeply personal journey. Each individual's path is different, and these signs may manifest in varying degrees or not at all. What is consistent, however, is that as our loved ones age, they rely more on our presence, our patience, and our compassion. Recognizing these signs not only helps us understand what they may be going through, but also empowers us to offer the support and care they need during this precious time. The physical decline, cognitive challenges, and emotional shifts we've discussed are all part of the natural process of aging. But beyond the physical changes, what truly matters is how we respond. It's easy to become overwhelmed by the changes that come with aging, but by understanding these signs, we can make informed decisions about how to care for our loved ones in a way that honors their dignity and preserves their sense of self. They may no longer be able to do the things they once did or engage in the same activities, but they still deserve the respect, love, and understanding they've always had. While these signs may feel daunting, they also give us the opportunity to connect on a deeper level with those we love. By offering support, providing comfort, and showing patience, we allow them to feel seen, heard, and cared for as they navigate their final years. These moments, though emotionally challenging, also become a time for meaningful reflection, for cherishing the memories that have been created, and for sharing in the process of closure together. As difficult as it is to acknowledge that an elderly loved one may be nearing the end of their journey, it is a reminder of the fragility of life and the importance of making the most of the time we have left with them. Sometimes, simply being there, offering a hand to hold, a kind word, or a quiet presence, can provide more comfort than anything else. The end of life, though inevitable, is also an opportunity to celebrate the life that has been lived, the love that has been shared, and the legacy that will continue on in the hearts of those who remain. Ultimately, the signs we've discussed are not to be feared, but to be understood. They help us provide better care, more compassion, and a deeper connection. By recognizing these signs, we ensure that our loved ones are not just surviving their final years, they are living them with dignity, comfort, and the knowledge that they are surrounded by those who love them. As you continue on this journey with your loved ones, know that you are not alone. Many are walking this same path, offering care and love as they honor the final chapters of the people they hold dear. And when the time comes to say goodbye, you can find peace in knowing that you were there for them, every step of the way.